Welcome to the Institute of Medicine of Chicago. Hello, my name is Pam Merriweather Argus. I'm a member of the Board of Governors of the Institute of Medicine of Chicago and co-chair of the IOMC Program Committee. In addition, I'm the Executive Director of Project Patient Care. It is my pleasure to welcome you today. Today's session is the fourth session in our April program series, Building Networks to Solve Critical Nursing Workforce Needs in the Greater Chicago Metropolitan Region. We are pleased to host this program with Rosalind Franklin University. We know from the COVID pandemic and other studies, there are many changes in the nursing workforce. Also, there is an expected shortage of talent of nursing in the Chicago area. Today's session will touch upon these issues in more detail. Today's agenda includes a discussion, question and answer period, and updates on the future programs and speakers. It is our pleasure to welcome our two speakers today. We are pleased to welcome Dr. Larson, who is the founding dean of Rosalind Franklin University's College of Nursing and vice president for clinical partnerships. Dr. Larson is a certified registered nurse anesthetist with a specialty in cardiothoracic and vascular anesthesia, and also holds a doctorate in public policy analysis. She has blended clinical nurse anesthesia practice with teaching, research, higher education administration, and partnership development. In 2021, she was distinguished to be inducted into the inaugural group of fellows of the American Association of Nurse Anesthetists. Dr. Shubik de Berman, professor of biological sciences, is the senior director for science partnerships at Lake Forest College. He is the DISD and Carol Graham Dean Professor of Life Sciences at Lake Forest College, Illinois. He is the college's Senior Director of Science Partnerships and chairs its Health Professions program. Dr. de Berman is a cell biologist specialized in neurodegenerative diseases and specifically studies the molecular basis of Parkinson's disease using yeast systems. He has served as the president of the Chicago Society for Neuroscience from 2013 to 2015, and the president of the National Council for Neuroscience Honor Society from 2017 to 2019. Dr. de Berman was honored with Career Achievement Awards from the Chicago Society for Neuroscience in 2018, and from the Faculty for Undergraduate Neuroscience in 2019. He was also named a 2019 Illinois Researcher to Know by the Illinois Science and Technology Consortium. Today's learning objectives are be able to share how community commitment, direction, and alignment is solving Lake County's nursing workforce needs and apply it to your workplace development. Explore an innovative longitudinal educational pathway to enhance the preparation and successful progression of learners into health profession careers. And third, recognize the challenges in implementation of educational pathways and apply its lessons learned. This program is accredited by Rush University and affiliated associations. You will be able to complete and obtain your continuing education credit at the end of the program. Our speakers have completed their conflict of financial disclosures, and this information is on file. On behalf of the Board of Governors, it is my pleasure to warmly welcome everyone today. We are honored with your overall support of IOMC. The overall attendance at the virtual session has surpassed over 1,000 attendees in the past year. We are thrilled with the overall support. Please feel free to also share ideas with us on programs. If you are visiting us for the first time, we conduct monthly virtual sessions, except during the summer months of July and August. In the fall, we expect to begin our work groups. Please stay tuned for more information on how to become involved within IOMC as a fellow. If you are not a fellow and would like information on membership, please contact Deborah Hodges, Association Manager and Program Manager at iomcstaff@iomc.org. IOMC is celebrating our 106th year, and in June, we will have reached our 107th year as an organization. IOMC is an independent, not-for-profit organization of distinguished leaders in the health field who collaborate to improve the health of the public. We are proud to draw upon the diverse membership and other regional leaders to address critical health issues. IOMC cordially invites you to their upcoming programs. On May 6th, IOMC is hosting the virtual program, Systemic Issues Impacting Chronic Kidney Disease and Health Equity. On June 30th, IOMC will be celebrating its 107th anniversary at the 2022 annual meeting and 2022 Healthcare Awards. Please plan to join us for these two upcoming sessions. The 2022 IOMC Healthcare Awards are open for nominations now. There are 7 award opportunities. The deadlines are May 2 and May 4 for specific award types. Please consider nominating a colleague or an organization this year. The awards will be presented at the annual meeting celebration in June. Please look for more details soon and register. There will be limited attendance at the events, so please register early. At this time, Dr. Larson and Dr. Schubik share their insights and experience in solving the critical nursing workforce needs with us. Dr. Larson, the floor is yours.
Oh, thank you so much, Pat, and hello to everyone out there in Zoom land. And thank you for the opportunity to share with you information about the nursing education pathway that we've been building for the last few years. Pat, if we just move to that next objective slide, we'll just get right down to business here. In today's presentation, we're really centering on 3 objectives that collectively tell Rosalind Franklin University's and Lake Forest College's story of bringing the Lake County community together to solve Lake County's disparity in educational attainment as the key strategy to solve its disparity in health equity and its nursing workforce needs. So when you look at that first objective, we're really looking at sharing with you our story of what gaps we were seeking to fill, why it matters, and how we are approaching the challenge. So quite simply, the gaps that we were seeking to fill, for starters, for Rosalind Franklin University, was we were seeking to fill an essential piece of our interprofessional health professions education portfolio. Registered nurses are the most prolific healthcare professional, numbering close to 4 million. And while our graduate level health profession university educates over 30 different types of healthcare professionals and biomedical researchers, we were not educating nurses. That is, with the exception of our doctoral nurse anesthesia program. However, nurse anesthetists represent only 1.3% of the total nursing workforce. Roughly 85% of the nursing workforce are registered nurses that assume direct patient care roles in a variety of settings, and the remaining 15% assume roles as advanced practice nurses, nurse executives, and nurse researchers. So we really needed to educate students who could be entering into the workforce as registered nurses. Second, RFU wanted to better serve the needs of our community. Our clinical partners were telling us they desperately needed our help to fill their tremendous gap in the supply of highly educated registered nurses who could advance patient safety, patient satisfaction, and innovation in nursing care delivery. But in addition, they needed an increase in the supply of nursing graduates who also represent the diversity of Lake County and the surrounding region. So Lake County Partners, one of the organizations in Lake County that leads economic development, has been a really strong collaborator with us in building this nursing education to workforce pathway. And one way in which they support us is with their workforce data. So in Lake County, pre-pandemic, their data showed that we had 300 unfilled RN positions in Lake County each year, projected throughout to 2028. Further, their data show 29% of Lake County's roughly 5,000 RNs are 55 years or older, placing Lake County's nursing workforce at above average retirement risk in comparison to the national average. So those were two key gaps we were trying to address. Shubik?
Thanks, Sandra. And for Lake Forest College, we are seeking to promote opportunities for our students to more seamlessly enter the healthcare professions and to also serve the needs of our community. As you may know, we are the major liberal arts college in the greater Chicago area, with 46% of our students hailing from either Lake County or Cook County. 35% of our students are Pell eligible, and we are ranked number 3 for social mobility in the country. As many as 40% of our incoming students identify healthcare professions as a future career. While many identify medical school as the initial goal, the vast majority of them pursue a diversity of healthcare professions beyond medical school. The US Bureau of Labor Statistics predicts that the employment in healthcare occupations will grow by 18% between 2016 to 2026. For reasons like these, our college has invested in strategic enrollment growth in sciences and health professions preparation. An important outcome of this is the official partnership that we have started with Rosalind Franklin University of Medicine and Science in 2019, with whom we have a long history and a growing sense of collaborative synergy. Our powerful cross-institutional partnership is unlike anything European institutions can produce. And the proximity between our college and RFU is not only convenient, it's an essential differentiator that can shape the future of healthcare education for our college. With RFU, we've created a new academic program to expose our students to very early to a large world of healthcare employment opportunities beyond medical school, so that they can discover the best matches to their interests and aptitudes. And in 2020, the Health Professions program was launched at our college. I'm very excited that next week, our first set of Health Professions program students will graduate equipped with the interprofessional acumen, which is Rosalind Franklin's core mission, and the college's liberal arts and sciences preparatory curriculum. For these reasons, the same reasons that have motivated RFU, our college is also investing in nursing preparation as a key new academic pathway within health professions. Our geographic positioning in Lake County, our historic commitment to diversity, and our existing strength in STEM education make us an ideal community partner in creating flexible pathways for BA, MSN double degrees with Rosalind Franklin's new College of Nursing and to contribute to our county's workforce.
Thank you, Shubik. And so the next question we wanted to discuss is, why does this matter? And it's an important question to ask because whenever you're developing a partnership network and you've got a project, you're going to need champions. And the champions that you select, and in this situation, it's really been Shubik and me, they have to be passionate about the cause. So Shubik and I would like to tell you our stories of why this matters to us. I've been a registered nurse since 1975 and a nurse anesthetist since 1983. And my first job as a nurse anesthetist was at Loyola Medical Center in Chicago. And back then we were literally doing about 2,500 open heart surgery cases a year. That wound up being my area of anesthesia specialization. But when I wasn't doing hearts, I would occasionally work with this phenomenal general surgeon. And he expected everybody to bring their A game. And occasionally when a resident didn't know their surgical anatomy or the sequence of surgical steps, he would say to them in a very sarcastic tone, "Yeah, why should it matter if you know your stuff? After all, it's just a human life." During my 28-year full-time clinical anesthesia practice that preceded my employment in academia at RFU, I methodically considered every step in the anesthetic plan that the patient and surgeon needed from start to finish. And I'd anticipate all the potential complications and have the contingency plans ready to go before I ever pushed a single drug. Because after all, it was a human life. As I was preparing this presentation, I realized that in the last few years, I've invested countless hours building partnerships to support the nursing education to workforce pathway. And I asked myself, why? Why care about a vision for a uniquely tailored educational journey that helps youth for 6 years prior to them ever matriculating into Rosalind Franklin University's Masters of Science in Nursing degree program for entry to nursing practice? And I realized that the answer is because it's about a human life and the impact that life can have on the lives of others. The core value I carried with me from my nursing practice is the same. It's just that now the lives I and our other nursing faculty and others who are part of this pathway are caring for are the lives of our youth, our students in our community, not our patients this time, who will become our future nurses.
Well, Sandra, I mean, every time I hear you speak about, your passion for nursing education, I get inspired. I just want to share with the audience my story as a college educator and why I'm passionate about this project. My story began with when I came to the United States at the age of 19 as a college dropout. Despite being accepted to the best of medical schools and engineering colleges in India at the age of 17, I lacked professional direction and career counsel, and none of those pathways were right fit for me. I needed more time to pursue my true interests, but had yet to discover them. This need for more time, exploration, and direction led me to a small liberal arts college in the United States. There, like many other students, I was truly transformed intellectually and personally by the deep educational immersion I engaged with faculty and peers. This experience also helped me identify my future career path. Importantly, I'm a member of a community in India that has traditionally been disadvantaged socially and economically. And essential to who I am as a professional is knowing what it is to be historically marginalized in one's own country and the challenges such communities face to overcoming barriers. So as a college professor for the last 24 years, I have engaged firsthand and daily in the power of what our nation's small colleges do best: impart the quintessential liberal arts education, but to each student in a highly individualized way. As science faculty, we serve as close guides and mentors to foster a deeper understanding of scientific content and impact the polishing of professional skill sets and a mindset that's key for healthcare professions. This one-on-one guidance matters greatly for students that hail from especially historically underserved communities. Such personalized approaches has a better chance of helping them overcome academic success barriers that can otherwise reduce retention and reduce motivation for STEM careers. It also can maximize the students' chances to find the best fit for a healthcare path that matches best preparation. Therefore, our college is really highly committed to investing in this new opportunity to help educate our nation's future nurses, especially so that our local students might one day work as healthcare professionals, giving back to their home counties where healthcare needs are so desperate. The potent combination of a strong liberal arts education and a master's degree in nursing to help create the next generation of nursing leaders can have a transformational impact on many human faces, and that is truly motivating.
So think of these faces as some of the youth in Lake County that we seek to serve by the new pathway. Lake County overall is ranked #1 as the wealthiest county in Illinois. However, 9 of Lake County's 27 zip codes are federally designated as high economic hardship communities. Further, in March of 22, U.S. News and World Report gave Lake County a score of 85 out of 100 for its economy, but only a score of 20 out of 100 for equity, and a score that is 3 times worse than the national median for racial disparity in educational attainment. People living in high economic hardship communities, and Lake County, Illinois is no different, have lower educational attainment, poor physical and mental health, and shorter life expectancy.
This is Lake County. In deep purple are the high economic hardship zip codes. 13,000 youth attend 7 public schools in them. These youth are at least 75% Hispanic and Black. And our data show that at least 5%, about 650 of these youth, may be dreaming of one day to become a nurse. These youth live in zip codes where only 1 in 4 adults hold a bachelor's degree. Compare that to 3 in 4 for our wealthier zip codes, where the median per capita income is $27,000 and the median family net worth is $125,000.
So Rosalind Franklin University, the green dot shown on this map, is part of their community. We're located in North Chicago, but we knew that the chances of these underserved youth selecting RFU's Masters of Science in Nursing program for entry to nursing practice as registered nurses was going to be slim to none unless we built an innovative educational pathway uniquely tailored for them. And we recognized that to do this well, we needed the help of Lake Forest College.
Lake Forest College is located 4 miles from Rosalind Franklin University, and you can see that as the red dot in this map. As you will note, we are one of us is immediately above, while the other is immediately below that line of demarcation that denotes Lake County's disparity in attaining educational equity as well as health equity in the county.
So helping our youth achieve their dream of becoming a nurse will have a tremendous ripple effect for Lake County. Each youth who progresses through the pathway will contribute to health equity in Lake County simply by overcoming its root cause, low educational attainment. Each individually and by recruitment of other youth through their example will contribute to building a diverse, well-educated nursing workforce to meet Lake County's critical nursing workforce shortages. Each will promote economic growth and health literacy in their communities when they learn, earn, and live in Lake County. In addition, our ability to interface with these youth during the pre-nursing years will improve our admission of them, our retention of them, and the knowledge and skills they will ultimately graduate with.
Next slide, please. So the nursing education to workforce pathway, or the new pathway, is really a very bold vision and requires a holistic and long-term relationship with the student to ensure that they remain in the pathway and that we can make significant impact on their educational achievements and professional development. Optimally aligning a broad coalition of community organizations and individuals who are committed to engaging and supporting the nursing pathway students and their families will be absolutely key to success. This is a community problem, and it really needs a community-based solution. So to accomplish this, we have developed a new advisory council, members of which represent academia, business, government, healthcare, and the community. Next slide, please. So to learn more about this pathway, I'd like to show you what the pathway is about, describe its 3 phases, and then state our goal.
So the new pathway, excuse me, as Shubik just referenced, has 3 phases. Phase 1 provides supplemental resources during high school and is in the final stages of development. Application to phase 1 will be offered to identified youth at the end of their freshman year. Most important to this phase is making sure that the resources we provide promote equity in their educational experience. Educational equity occurs when we build an educational experience that facilitates a student's progression across the finish line. One way to visually think about this concept is to think of the educational pathway as a marathon race. Education equality is when we make sure each student has admission to run the race. Education equity is when we make sure each student has a pair of running shoes that fit. In other words, an educational experience that fits their learning and mentorship needs and helps them achieve their highest potential.
The next phase of phase 2 represents the undergraduate phase for the pre-nursing student at Lake Forest College. This phase has already been developed and we have begun to implement it. This phase includes flexible speeds for our undergraduates, an accelerated 3+2 pathway where a student can earn a bachelor's degree from Lake Forest and their MSN degree from RFU in 5 years, or a more traditional 4+2 plan. We've also created academic articulation agreements with nearby junior colleges for students with associate's degrees to complete their pre-nursing and bachelor's requirements with us in 2 years and then proceed to Rosalind Franklin University.
Phase 3 is Rosalind Franklin University's 24-month Masters of Science in Nursing degree program for entry to practice. This program is fully developed and is awaiting the final stage of approval from the Higher Learning Commission. We hope to matriculate our first cohort 10 months from now, and I'd like to give recognition to our chair program director for this program, who is Dr. Lori Tenti.
During all these 3 phases, we expect that as part of this pathway, on average, students will work 8 hours per week over the course of a year, even while they are in high school at clinical partner sites. Opportunities will exist in our health system partners to collaborate with both Lake Forest College and Rosalind Franklin in a variety of ways. For example, to influence nursing curriculum development, undergraduate internship experiences, and early employment opportunities as nursing assistants, medical assistants, or interpreters.
So let's take a little deeper dive now into phase 1. Our community members and high school counselors have helped us understand that the 4 programs that we've designed for the phase 1 pathway must support students and their families by providing academic support, in particular to improve their math and chemistry aptitude, holistic mentorship that promotes confidence and feelings of inclusion, as well as physical and mental wellness activities, financial planning, especially knowledge and support to cover educational costs, professional development, including awareness of the advantages afforded to an MSN prepared nurse, and healthcare related employment during high school that supports their college aptitude and contributes to the family income. So in phase 1, to meet these objectives, excuse me, these services will be provided through 4 programs, and they're called Science Saturday 1, Science Saturday 2, Nursing Inspire, and training to become a certified nursing assistant, medical assistant, or medical interpreter. So Science Saturday 1 and Research Inspire, that first and third program that you see on the slide, are already existing and highly successful programs that RFU offers. And these programs were developed and are overseen under the leadership of Dr. Hector Riscado Flores, a PhD research faculty member at RFU. And so we'll be procuring resources so that we can expand enrollment in this program. So that's Science Saturday 1, which is a lab-based course that meets for 10 weeks on Saturdays for 4 hours. Science Saturday 2 is currently under development and will apply topics learned in the first lab course, such as pH, osmolarity, the metric system, to actual clinical care scenarios. And both programs will include a lot of hands-on and interactive learning. Research Inspire is RFU's full-time summer program that provides math and science enrichment, research opportunities, mentoring by graduate students, ACT training, and other types of college prep assistance. And in addition, students receive a stipend for participation. So the second program that we're building to complete phase 1 of this pathway is called Nursing Inspire. So instead of Research Inspire, it'll be Nursing Inspire. It'll be modeled after that existing program, but will become a separate specialty branch, and experiential learning will occur through internships with our healthcare partner sites in lieu of research laboratories, and will focus on the development of nursing skills and knowledge.
So in phase 2, we would expect that students interested in nursing careers would apply to Lake Forest College and would be accepted either directly through high school or through community junior colleges. And they would be invited to apply to Rosalind Franklin's Master of Science in Nursing program. Once conditionally accepted to the special dual degree program, our students would engage in several key signature features that define our nursing pathways program at the college. Firstly, students could combine their pre-nursing curriculum with any major of choice at our college. They do not have to be a life science major. For example, they can major in Spanish, music, and business, pursue something they really are interested in. They would complete the nursing professional development course, a new course that we are adding to our curriculum in the first semester that they are here. And this course is designed to build cohort identity, community, and resiliency. And it would provide weekly study tables for collaborative group study for their pre-nursing courses. We have just hired a full-time science resource coordinator in our Center of Academic Success to make sure that there is strong academic support for the entire pre-nursing science curriculum. Each of our nursing students from freshman year would be paired with 2 mentors. One of them would be a professional nurse from one of our clinical partner sites, and the other one would be an advanced student, either at the undergraduate or at the master's level. These students, so our first year students can start building a network, gain a window into the profession with motivational guides with support and resources. This is important because this allows our students to keep their eye on the prize, while even when early science coursework could be challenging or sometimes a perceived barrier. The students would engage in early immersion nursing internship experience with one of our clinical partner sites. And this would happen right after their first year. In subsequent summers and academic years, once they are certified as a CNA, for example, they might be able to get employed by these clinical partners as medical assistants, nursing assistants, or even patient care technicians. The students, very importantly, would complete our new health professions program. This is key because through this program, they would complete 2 humanities courses, which have science and health content. This provides a humanistic perspective in our future nurses. Also, they would take 2 seminar series courses taught by Rosalind Franklin faculty. Through these courses, they would gain insight into a variety of healthcare professions and healthcare professionalism, the social determinants of healthcare, the impact of key lifestyle factors on health, and the intersection of healthcare and humanities and social sciences. This is where the liberal arts really come through.
Yeah, and I don't know if you recall Shubik saying earlier, we graduated 48 students from this program this week. So we were celebrating with them. It was a lot of fun. So phase 3 is RFU's 24-month program of study to earn the Master's of Science in Nursing degree that enables the student to be eligible then to sit for the RN certification exam and obtain licensure to practice as a registered nurse. In addition to students learning nursing practice for the various specialty areas that include pediatrics, adult medical surgical nursing, women's health, community care, and mental health, and all the foundational science courses that they take in physical exam assessment, pathophysiology, pharmacology. They will also take courses such as organizational and systems leadership, quality improvement and safety, translating and integrating research into practice, informatics and healthcare technologies, health policy and advocacy, interprofessional collaboration, population health, and collectively, this curriculum will provide the graduate with the foundational knowledge needed to advance patient safety, patient satisfaction, and innovation in nursing care delivery. We hope that our graduate will be ready to hit the ground running and meet the needs of our healthcare system partners.
So through this three-phase pathway, what is our overall goal? We hope that by 2032, each year, 100 youth living in high economic hardship zip codes will graduate from phase 1 program with certificates in Science Saturday 1, 2, and Nursing Inspire, and with certification as nursing assistants or medical assistants or interpreters. 75 of these youth, we hope, will earn bachelor's degrees, with the majority of them attending Lake Forest College. And at least 50 of these youth will be admitted to Rosalind Franklin University to earn a BA and MSN degree within 5 or 6 years. And most, if not all, of these youth will become employed as registered nurses in our local healthcare systems. So our third objective is to recognize the challenges to successful implementation of our educational pathways. The first challenge is to build a comprehensive partnership network. The second, to optimize direction, alignment, and commitment. And third, to secure resources to ensure the sustainability of our pathway. So for starters, over 2 years ago, we didn't really have a blueprint in how to go about this. So we needed to figure out how to build a partnership locally and then beyond. It really was one conversation at a time, a very organic process that led the coming together of community partners, of individuals and organizations who became committed to the same goal as depicted in the slide. This collaborative work over 2 years has evolved currently into our advisory council that will guide our nursing workforce development moving forward. Now, rather than give you details of what we went through the last 2 years to where we are now, I thought I'd just give you 1 or 2 examples of how this organically evolved to where we are at. So the first example I'd like to give you is with Northwestern Medicine, one of our key clinical partners. In early spring 2020, there was an important leadership meeting between the leadership of Rosalind Franklin, our college, and Northwestern Medicine Healthcare. That conversation and meeting led to a memorandum of understanding where the 3 institutions would support the new College of Nursing at Rosalind Franklin University. Through that memorandum of understanding, several things happened. Sandra and I began working with Karen Menke, who is the chief nurse executive, and her predecessor and their staff, which led to the creation of an important council, the Academic Practice Leadership Council for Nursing, that will guide all the nursing education and clinical training that will come about in the next few years. Sandra and I also began working with Seth Kidder, who's the program manager of community services at Northwestern Medicine. And that led to eventually the creation of our Lake County Health Professions Education to Workforce Advisory Council. I began working with Kristen Somberg, the Director of Operations and Professional Practice and Development at Northwestern Medicine. And that led to the creation of our pilot nursing internship program for our undergraduates. We've started this already. In fact, last summer, we had 17 students who got their nursing immersion experiences. And in fact, 2 of them are now in MSN programs already pursuing their nursing degrees. As a second example, my colleague in the biology department at the college, Ann Main, is also a member and elected official of Lake County Board. As part of that role that she plays, she connected us with Lake County partners, which has now become very important to our enterprise. The main individual in Lake County partners, Bethany Williams, then connected us to Lake County Workforce Development, which has now become a very important governmental partner in our council, and with whom we are trying to develop additional opportunities for our students to get clinical training?
So our second challenge was in figuring out, we had this very committed advisory council, but we needed to figure out how we were going to function as a team to accomplish the end goal of building a diverse, highly educated nursing workforce. And initially, we set up subcommittees with roles and responsibilities associated with building phase one of the pathway. And then we assigned members to subcommittees. And quite honestly, it simply did not work. Our mistake was that we had created an advisory council that we were asking to function as a workforce group. And it was really our desire to build this together that caused this failure. But what we really didn't appreciate was that we needed to first identify a core team with the expertise, authority, and responsibility to design and implement each phase of the pathway curriculum. And that it was this core team and the resulting pathway that then would be supported by the advisory council and all the other partners that are in our community, that we keep, it just keeps snowballing. Anyway, one guide that we used to get us back on track is titled Direction, Alignment, and Commitment. And it's written by the folks at the Center for Creative Leadership. And as I said, our advisory council had strong commitment. That wasn't our problem. All of us intimately understood and valued the importance of bringing the Lake County community together to solve Lake County's disparity in educational attainment as our key strategy to solve disparity in health equity, and to also solve our nursing workforce needs. And to quote Bethany Williams, who's our advisory council member representing Lake County partners, one day she passionately said, "This pathway is both a moral and economic imperative." So we had strong commitment from the members of our advisory council, and the strong direction with our advisory council network members would occur when we had agreement on the overall goals and what success would look like. So we were having a little difficulty with direction and a lot of difficulty with alignment. And what we came to understand was that we had strong direction about the end goal, but we were confused about the sub goals along the way, because we had not, once again, clearly defined the three phases of the pathway and the curriculum or program parts that supported each of these phases. So our direction challenge then contributed to our biggest challenge, which was with the alignment. And so our subcommittee process, as I said, it didn't work because in our desire to lead by valuing participative engagement to build the pathway, we actually failed to appropriately align the expertise and resources that each partner could reasonably bring. So fast forward, we aligned the role of RFU and LFC as having the responsibility and authority to develop, implement, and evaluate the phase one pathway curriculum. Then we identified the expertise and resources of advisory council members and others outside the advisory council in alignment with those needs that we would need, the resources that we would need to inform and implement the curriculum design. And once we figured out how to optimize the roles of the advisory council members and the partners overall, each challenge in developing and resourcing the pathway actually started to become fun.
So the advisory council, of course, is made up of many different diverse groups of entities. And I thought in this slide, at least we should share some of them with you. And this is a growing list. of individuals and organizations. So included in academia are Illinois Institute of Technology, Institute of Design, College of Lake County, and hopefully other community colleges will follow, including Oakton Community College, and of course the several public and private high schools in the area, including those 7 public schools in the economic hardship zip codes. The business partners such as Lake County Partners, government partners such as Lake County Workforce Development and Lake County Board, and in fact, growing list of healthcare clinical partners, some of which are listed here. But key among them are Northwestern Memorial Healthcare as well and North Shore University Health Systems. And a number of individuals from the community, including a parent, Maria Kalunga, and a pastor from a key church in Waukegan and others.
So we would like to end this presentation by giving you some examples of how we are aligning our work, and at the same time showing you the faces of some of our partners. But at the same time also acknowledging that there are so many other committed partners that we would love to have shown on this slide. And you know who you are, and you know how grateful we are for you. So as we look at this first individual on the top and left, that's Dr. Lori Tenti.
And Lori has been very important in helping with the undergraduate curriculum development at Lake Forest College, as well as, of course, the master's curriculum that she's going to chair at Rosalind Franklin. We have gained insight from her also in how Rosalind Franklin is developing the phase 1 curriculum, and it gives us an opportunity to engage with Rosalind Franklin in developing their phase 1 curriculum for high school students. We also are working closely with Rosalind Franklin in terms of admissions, marketing, and recruitments between the 2 admissions offices at Lake Forest College and Rosalind Franklin University to align and make sure that there is a cohesive mechanism by which we attract the students who really should learn about our programs and help them to be part of this pathway.
So the next picture that you see on our slide is of Mr. Damar Harris, and he is a project manager with Lake County Workforce Development and a member of our advisory council. And he's really helping us facilitate federal funding that will support students during the phase 1 programming activities, as well as during the phase 3 activities. His mother, interestingly, is a registered nurse who practiced in Lake County for over 30 years. She's also a community member of our advisory council. We recently posted our job descriptions for the MSN program, and we were getting lots of applicants, but no diversity. And so we picked up the phone and we called Mary and said, Mary, we need your help. And as soon as Mary got the word, all of a sudden, we were getting a diverse pool of highly qualified faculty applicants from the African-American community. So just an example of how we're aligning the expertise and resources of our advisory council to help us meet the needs for the pathway.
Sandra, I know that we should be wrapping things up and giving a chance to have questions and answers, but I thought I'll at least thank 2 individuals here from Lake Forest College, Professor Ann Main and Professor Dawn App Perkins, who have been instrumental for academic success and for connecting us with individuals who are in the council.
And Shubik, I'll acknowledge Karen Mankey, the Chief Nurse Executive from Northwestern, Anthony Cunningham, who is our College of Nursing Director at Rosalind Franklin in the lower left, Bethany Williams from Lake County Partners, then Maria Kalunga, who is our parent liaison from Round Lake High Schools. Shubik, you talked about Dawn Apt Perkins. And then finally, but not least, is Sharon Hartwig, who is one of our counselors with the Crystal Ray High School, who has really helped us understand some of the needs and concerns of the students and parents. So thank you so much. for the opportunity to share this pathway with you.
Well, thank you. Thank you, Sandra, and thank you, Shubik. This is an outstanding program. And, and if anyone has questions, please put them in the chat and we'll be able to answer them. I do have a couple of questions, and one starting out is, one of the challenges always is the cost of education. And there's a sense among many populations that there's no way I could ever afford to go through a healthcare professional career and go to college for that. So what are some of the ways that you're making it so that there is equity and there is an ability to achieve that goal?
So one of the first things we ask ourselves is, what is a reasonable student debt? And we used federal guidelines and said that a student should be able to pay back their tuition loans within 10 years and not have that payment, that monthly payment, not exceed 10% of their gross income. And so we just made an assumption that these nurses would be starting out making roughly $80,000 a year. And we worked backwards and said, our goal is to make sure these nurses don't have a debt, nursing students don't have a debt greater than $50,000. And so once we knew that was the goal, we started working then once again, okay, how do we get to that goal? And Shubik, I'll let you give some examples.
Sandra, I think it's very important that Pat asked this question, because we do expect that a large number of students who will populate this pathway will come from economically disadvantaged first generation or underserved STEM population communities. And it's important that we come up with a mechanism to reduce the barriers that these students face. And so I think at the undergraduate level, as well as at the master's level, we are working hard to create scholarships where the actual the financial load on the students is as minimum as possible. And I think that is going to be key to the success for students to engage in this pathway, as well as the education of parents of the students in thinking about financial literacy, starting as early as not just high school, maybe even earlier, to gain their commitment to get their children to be involved in this pathway.
Yeah, and Pat, it is such an important question, because it could be the limiting barrier, right? Mm-hmm. So when we have our conversations, for example, with North Shore, they're already re-envisioning the benefit package they would provide this graduate for paying back their loan. Mm-hmm. So that's one way. Another way is, as we looked at what the students' living expenses as well as the tuition are, that is why we've promoted the opportunity for them to be working on average at least 8 hours a week in the healthcare system, in jobs that not only advance their professional development, but are literally paying them at rates that are between $15 to $20 an hour and supporting them in this journey. We're looking to, we're working with our institutional development teams, both together across our two institutions, to get scholarship funding. So there's a number of ways, but the other way is we're looking at federal sources, and Lake County Workforce has been a huge part of that process in helping us identify federal sources that come to our state that can also support the costs for these students' education.
That is amazing how the package that you've put together, as well as the leveraging of other resources in the community, because oftentimes people will just think it's all the onus is on them, the educational, but using the workforce development, using the Lake Forest, Lake County initiatives, as well as the federal government, again, is really critical. So congratulations. I know it's hard putting that together, but again, it is a wonderful opportunity. Actually, one of my sons was in the service, and as soon as he was at Mount Sinai as an EMT, then he got deployed again. But before he got deployed, he got accepted into Rosalind Franklin, the PA school.
Oh, that's wonderful.
But it was also the support, the financial resources that were provided as well, because the PA program now, if you're in the service, it's an entryway into programs. So again, great leveraging that goes on. One of the questions I had is, again, you've got a great stream of students that are very interested in pursuing healthcare careers. Has anything, because right now, many nurses are leaving the field and not leaving happily, leaving because they're not happy. And then there's, we've seen issues over salaries, workforce conditions, violence against staff, and also the recent occurrence with a nurse with a safety issue, and speaking out on the safety issue. So how are you managing to attract and provide that comfort level that things will be better?
Wow, that's a big question. So let me kind of try to answer it in pieces. Your last question was related to a recent court case where a nurse who made an error, a medication error that resulted in a negative outcome for a patient, and of course the patient's family is part of this, was tried in the criminal system as opposed to the normal system where your license is examined and you are charged through the civil courts with a malpractice case. When I look at that case and just simply what I've read in the media, what is evident to me is that any error, and this error is no different, is a system error. Mm-hmm. And this case in particular, when you dissect it, I could see two system errors that happened as a result of technology glitches that are safety protective system errors. The next one, I saw a human error. Mm-hmm. And we know to err is human. Right. And the fourth error I saw was a knowledge deficit. And I think the one takeaway, we can't solve all problems individually either, but we take what we can solve. And the key takeaway for us and our nursing faculty is the knowledge piece. We need to make sure that the students we graduate are competent to practice. And knowledge is, nursing has become so complicated, and what you need to know is so advanced, which is why we propose a Master's of Science for entry to practice. That's one thing. Number two, you're right. Nursing is facing a lot of challenges right now. The most current data on what's happening in the nursing workforce is coming out of the Montana University and Montana State University in Dartmouth. There are some researchers who have for 15 years done all the workforce nursing data. What they're showing that's concerning is that while two trends, while applications overall to nursing programs still increased this year, they increased at a lower rate. The second thing that's most concerning to me is that we're seeing nurses leave the nursing workforce that are between the ages of 35 and 55. We actually have a drop of about 4%. We haven't seen that in over 30 years. And so has potential to have a big impact because we're losing a generation of nurses. We also know that we're losing nurses to retirement, but I actually think that that loss is going to be less than what happens if we continue to lose nurses in this mid-aged range because of dissatisfaction like you're talking about.
You know, it seems like such a roller coaster, because at the beginning of the pandemic, everyone was so supportive of the healthcare professions and they were rallying around them. And then somehow we got lost along the way because now it's, you know, they're not feeling the love and support. So I think it is going to be a challenge, but I think the nursing career pathway, the healthcare professional pathway that you've outlined is really going to be a success story. And I'm hoping that you'll come back again next year too, so that we can continue and see where you're at, because I do believe, I sometimes refer to the one and done programs, where you do a few Saturdays and everyone's done. But there's no continuity, there's no support along the way. And if we want communities of disadvantaged populations to be able to participate, they need the support. That's the equity equation that we need to put forward. And you have done it so successfully. I mean, Rosalind Franklin University and Lake Forest College need to be commended for the leadership that you've shown on this issue. And again, I know you have early results, which are very promising. And I suspect by next year, it's going to be even greater results. So congratulations to you. This is outstanding. Before we close, is there anything else that you would like to add?
The only thing I would say is, despite the fact that healthcare professionals are feeling hit by the pandemic and might be disillusioned, there is no dearth of interest from prospective students at the high school level and those who are thinking about college. It's sky high. So I'm just excited about the potential there for a generation of younger people to enter the healthcare professions and becoming as best prepared as possible.
No new things that I would like to share other than thank you. And we look forward to presenting again next year.
That is wonderful. Thank you so much. And again, I know we all thank you on behalf of all the attendees, but also the ones that will be listening to this later on, because this was very insightful. And it was, again, such a relevant approach and successful approach to addressing the disparities that exist, as well as providing opportunities, creating that equity equation. I want to remind everyone of the IOMC Healthcare Awards. The closing deadline is next week for all submittals, and please see the IOMC website for more information. Thank you all for attending today's session. We hope to see you on May 6th for the chronic kidney disease session. Also in person on June 30th at the annual meeting and healthcare awards for the first in-person session convening since 2020. Look for the survey link to obtain your CEUs for today's session. Please follow us on LinkedIn, check out our blog, and visit the IOMC website for more details. And again, a special thank you to Rosalind Franklin University and Lake Forest College. Thank you so much for what you've done and what will be the future as well. Have a great day and a great weekend. Thank you.
Thank you.
Thank you.